Hey guys, hey, Dr. Ash here with another quick and short video. This time today we are going to talk about fundamentals of nutrition concepts. So this should be very quick, but it will be the foundation of everything that you need to start out your nutritional journey. So let's get started. So let's talk about basic nutrients. We've got a couple that we're going to talk about. The first one are calories or kilocalories, which are basically just your requirements for functioning. It's what your body needs every day in order to do its vital functions, have energy. So basically just talking about your energy demands. And the interesting thing is that calories and kind of weight go hand in hand, right? We hopefully have known that if anybody's had any weight issues or maybe you've tried to gain weight or lose weight, they always tell you watch your calories. So the same thing happens here, except a lot of times in nursing, we like to call it energy demands. So when we meet our needs, we have weight maintenance, which means our weight does not change. So when we meet the needs of our body, our weight stays the same. If we exceed, then we gain weight, and if we're deficient, then we lose weight. At least that is the science behind it. So let's talk about carbohydrates. Carbohydrates are considered your primary source of energy. Fats, which everybody says make you fat, but that is not true. It's just the types of fat that we consume, but it cushions and protects your internal organs. And fun fact, females, genetically females, our ovaries love a little bit of fat pad around our midsection, which is why it's a little bit harder, excuse me, to lose weight around our lower abdomen area because our ovaries and our uterus and all those fun female functionings just love a little bit of fat and cushion. But the other thing with fats is that it actually helps with our brain and our nervous cells, our neurons, in their development as well as their healing and as well as their functioning. And so, what you're going to find is that if you ever have a question in regards to an infant, or if you've ever had a baby yourself, you've heard these comments before. They always say they want you to go to whole milk after you transition from formula or breast milk. And that is because of the fat content in whole milk, because we want to help continue to develop their neurological system. And so you will hear oftentimes that fat is helpful for the development of that neonate or that newborn moving into a almost toddler phase. It's helpful for their development. So full fats are not all bad. Next, we'll move into proteins. Proteins are wonderful for tissue repair, muscle repair, growth and development, wound healing. They are just very good nutrients in general. So, if you don't know this, congratulations, you're going to find out right now. When we exercise, we actually tear down our muscles because we stretch them past their limits, right? So when you stretch a rubber band, it kind of gives and breaks just a little bit, especially over time. And so those proteins really go in there, break down into amino acids to help fill in the gaps of those muscles to help for muscle growth. So, fun fact. Last thing I want to talk about here in regards to nutrients is nitrogen. And the reason why nitrogen is so important is because nitrogen comes from our consumption of foods, but primarily it's going to come from protein intake. So, again, in nursing school, we don't ask direct questions like, "Oh, protein is the best blah 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 for wound healing," right? We like to ask roundabout questions. And so you may often hear of a patient with a positive or a negative nitrogen balance. So, in order to be a positive nitrogen balance, we have to intake more protein in order to produce more nitrogen in the body. And if we're deficit, we're not getting enough nutrition. But we're going to talk about malnutrition here in just a second. So, when we think about nitrogen, I want you to think about patients needing wound healing and tissue repair. Also, patients that may be in a high metabolism state. Now, if you watched anything on vital signs or if you learned anything about vital signs and thermoregulation, our temperature, when it goes up, maybe with a fever or an illness, that is a state of high metabolism. And when we're in high metabolism, we are burning through these things very quickly, and we can quickly get in a negative nitrogen balance. And so, those patients that are ill or sick or have a fever, i.e., your hospitalized patients, they need a higher protein diet in order to get a positive nitrogen balance. And then also anybody with wound healing issues like burn victims, um, people who have pressure ulcers or very deep wounds or non-healing surgical wounds. Those are going to be your prime candidates for a positive nitrogen balance. Risk for malnutrition. So we can't talk about nutrition without talking about malnutrition. And I will go ahead and tell you the number one or two, I guess, populations that are at risk for everything in healthcare is the elderly and young. So those are always good answer choices when it comes to nursing tests. But malnutrition, either the very old or the very young, but also people who have chronic illnesses like strokes, AIDS patients, dementia patients, anything that they're dealing with long term, patients that live alone because they don't have the family support maybe necessarily in the home to prepare meals or to go to grocery stores, things of that nature. If they're homebound, so if I have a patient who's had a stroke and they can't drive anymore, they're going to be at higher risk because who's going to give the groceries? Who's going to cook the food? Things of that nature. And then, of course, probably our most obvious one here is low socioeconomic status. Anybody who's lived in America for longer than 5 minutes knows that McDonald's has a one, two, $3 menu or value menu or whatever it's called these days. Yet our salads are still astronomical, right? So we go to the grocery store and we buy fresh fruits and vegetables or even the farmer stands. Those are highly expensive items, whereas you can get a burger and fries for relatively cheap. So unfortunately, we've got the script a little bit flipped here in the US when it comes to health and our population. So let's talk about the elderly just for a moment, simply because they are a high risk category. They lose things, right? As we get older, we lose muscle tone, we lose our hearing, we lose our sense of taste, we lose our vision, we start to lose our teeth. A lot of things that contribute to nutrition and stopping to eat kind of happen as we get older. And so you need to think about it. Our taste buds and our sense of smell go hand in hand. So our taste buds, technically, I think you learn there's only 7 different flavor spots, but yet we experience all these wonderful flavors whenever we eat, and that is because of our sense of smell. So our sense of smell and our sense of taste together gives us over 107, is it 107 or 170? I can't remember. It is a lot of different flavors, which is why we can taste the spicy and the tangy and the lemon pepper and all those fun senses that everybody loves. That also explains why whenever you have a sinus infection, you don't really feel like eating because the food tastes bland. That is because you can't smell, and if you can't smell, you can't really taste. So anyways, long story short, the combination of a loss of smell along with the loss of the taste buds makes them generally not interested in eating. Also, the loss of teeth. So we need to make sure that their dentures fit appropriately, right? Nothing's worse than having no dentures to be able to chew or eat with. Also, the fact that they get easily distracted. So make sure that you give them uninterrupted time to actually eat. They kind of go off on different little tangents, if you will, especially our dementia patients. And as we get older, we all kind of have memory loss. And so it's very important for you to let them have uninterrupted meals. So, well fitting dentures, uninterrupted meals, make sure that whatever you're making is something that they're interested in, so they want to eat. And then also give them their glasses if they have trouble seeing. I don't know about you guys, but I don't like eating anything I don't know what it is. So I like to be able to see what I'm eating. Just a couple of other considerations that kind of go into other than the elderly, but this works for the elderly as well as other populations that may need help with nutrition, maybe like our AIDS patients or maybe like our weight loss patients that are trying to gain weight, things of that nature. We love the term small frequent meals in nursing, like always and forever. That is like a good go-to answer. So small frequent meals. Also, you got to understand high calorie meals and snacks as well as high protein meals and snacks. Again, that's going back and tying in that positive nitrogen balance that we talked about at the beginning of this video. So there you have it. That is all. Oh, nope, I have a couple of more things. We're going to talk about dysphagia too. So dysphagia literally means difficulty swallowing. Oh, that's right, because we're going to talk about NG tubes as well. Dysphagia happens very commonly in our elderly, but especially in our stroke patients that have particularly affect their swallowing and their speech. These patients may require thickened fluids, which again would come down from a nutritionist, from a provider, things of that nature. So, not really anything that you have to worry about. And then what you would have to worry about as a nurse, a potential nurse in the future, is putting down or inserting a nasogastric tube. So let's talk about that really fast. So our nasogastric tube is placed for usually one of two things. It's usually for difficulty feeding because they have dysphagia or they're unconscious or for whatever reason they need nutrition or the stomach needs decompression. Well, of course, we're in nutrition, so we're not going to address stomach requiring decompression. Our focus here is difficulty with feeding. How do we measure it? We measure it from the tip of the nose to the earlobe and then from the earlobe to the xiphoid process. Most average adults, you can put a little star by this, but most average adults, and if I say put a star, not because it's like overly important, but because it may vary, most adults are going to be anywhere from 55 centimeters to 65 or 70 centimeters. Okay, so that's just a general guideline. So if you're measuring like a normal size adult and you get a number that's way off from that, you might want to remeasure. And here I have a picture of it just so you can see exactly what it has to do, which is the reason why we measure it the way we do. You can see that the tube, there's a portion of it that sticks out of the nose, and you can see the distance it has to travel to get down to the stomach. And I've also given you a picture of what's called a Salem sump, and that Salem sump is really good for either or for both actually. You oftentimes we can put it in to decompress the stomach initially or to do the things we need to do in that aspect, but then turn it into a feeding tube. But either way, this is one of the types of mini tubes that are out there, certainly not all inclusive. So placement, what do we do for placement? It's a very scripted step-by-step process. We want to verify the orders. We wash our hands. We introduce and explain ourselves to the patients. We want to make sure we have gloves, a cup of water, maybe some lubricant. We're going to place them in a high Fowler's position. So we really want these patients sitting up nice and straight. And that's because we want to let gravity help us get this tube down. All right. So after we measure the patient's nasogastric tube, we're going to give them a small cup of water because we really want them to swallow while we're inserting this tube. We're going to make sure we have a nose or a nostril or nares, whatever you want to call it, that is open. And that's how we're going to go into it. Okay. We go into the nares. We begin to have them swallow. That's because we want that epiglottis to close the trachea and allow for us to pass that tube into the stomach. That's also the reason why we have the small cup of water because it's going to help it go down, but it also helps move those muscles of the esophagus to get it down into the stomach. All right, we end where we measured it, and then we're going to verify placement. And we can do that a couple of different ways. I can tell you this is going to depend on the type of tube that you have, but you can check residual. Not all tubes will give you that. You can check the pH of the fluid. There is an air bolus method that I particularly like, but it's a little more complicated than the purpose of this video. And then there's X-ray. And of course, X-ray is the gold standard. Anytime we have especially a small NG tube, a small hold NG tube. We want to make sure we have that X-ray because the X-ray is going to be the best way, the very best way to confirm placement. All right, and then let's talk about the purpose, of course, is to supply nutrition. So when we're going off to start feeds, there's a couple of things that we want to do. And again, very scripted in this order. Sometimes schools ask it, sometimes they don't. But of course, we want to check the bed. We want to make sure the head of the bed is at least 30 degrees, preferably 45, but at least 30. We want to verify the placement. We can either do the aspirate, we can double check the x-ray, you can make sure where it's taped at. Doesn't really matter, just verifying that placement. Checking the residual, flushing with 30 milliliters of water to make sure it is nice and patent, and then we can start our feeds. All right. Medication administration. Yep, medication is the last of this little script here. I told you I like to keep it nice and short and sweet. So medication administration. Of course, if we have a patient that's difficulty swallowing and difficulty getting things in, it's going to be hard to get their medicines in too. So this is where we rely on med administer or the nasogastric tube. And so our preferred method is going to be liquid because we don't want the tube to clog. It's easier to go down. The steps are a little bit easier. The tube is really made for liquid, not solid. So if you have like a whole list of medications to give, one of the first things that I would do is call the pharmacy to see if any of these can be in liquid form, because that is going to be really the preferred way we go about this. When liquid is not available, though, we can crush or dissolve medications. We would actually want to crush them into a fine powder, as fine as we can get. Use a little bit of warm water, dissolve it. Um, of course, we can't have any sustained release or extended release medications because when we crush them, we change that value. It no longer becomes sustained or extended release. These medications should be given individually, and I'll tell you why. Number one, there may be some compatibility issues when we break them down. They're more like their chemical foundation. And so when we crush them, there may be some sort of chemical reaction if we mix them. So that is a big no-no. And then also, if something happens, like the patient moves or you accidentally spill or anything like that, how are you going to know what med you already gave? So it's really, really important that we give them individually so we know exactly what the patient got. That way, if there is an error, something happens, we know it's down to one, maybe two medications instead of 10 or 20. And then, of course, afterwards, we want to flush. We want to flush after each individual med as well as at the very end. Now, I want you to use some common sense with this. The book does tell you that you need to flush with 30 mLs of water after every medication. But I'm gonna go ahead and tell you, like, if you have 20 meds to give, that's a lot of fluid that you're giving your patient that may potentially have a fluid issue. So just be very aware that if you have a lot of medications to give, and I don't think this is tested anywhere, this is more like a real life scenario, but if you have a lot of meds to give, you want to be very aware of how much you're flushing in between. All right, guys, that's it. If you found it helpful, make sure you like, comment, and share, and I will see you guys in the next video.